When someone goes on a diet, not only do they end up losing fat, but they also tend to lose muscle. Now, with many of these very powerful medications called GLP-1 medications like Ozempic and others, which help people lose weight, there is a significant percentage. Some studies show anywhere between 25 to 40% of the loss of weight is coming from what's called lean tissue. And lean tissue can make up things like muscle and bone and organs, but about 50% of lean tissue is really from muscle. So again, when someone loses weight, they tend to also lose a significant percentage of muscle out of that weight loss. So with millions of people who potentially will end up taking these kind of medications to help with weight loss, the question is, what will be the effects if they lose all of this muscle? And so muscle is critical. It's important for our health and longevity. For example, there was a study that looked at 1,700 men, average age 77 years, and what they found was those people who were missing muscle, what they call sarcopenia, that they ranged in, depending on severity of how much muscle loss, anywhere from 2.5 to 4.5 times higher risk of having a disability compared to those in that age group that weren't having loss of muscle. And in terms of mortality, they found anywhere between 50 and 70% higher risk of mortality in those patients who were older and were having muscle loss. As we see, muscle and muscle mass is critical to our health and longevity and functionality. And so for those patients who are going on a diet, which can be important to reduce the risk of obesity, the question is, what can we do about not losing too much muscle? And here's where exercise can play a role. And so in this video, I'm going to go over how exercise can help reduce the risk of losing muscle when someone is losing weight and what types of exercises are best. Hi, I'm Dr. Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. Weight regain after someone has lost weight is a difficult problem to overcome. Many patients who lose weight tend to put that weight back on. And many patients who are taking these anti-obesity medications like Ozempic, a very high percentage of them will stop taking the medication within a year because of side effects, usually GI side effects. Some studies show that up to 50% of patients will put back all their weight within 1 year, and that only about 25% will have over a long run, over 5 years, keep that weight off. So we can see it's a significant problem putting back weight after weight loss. When patients put back on this weight, unfortunately, they tend to put back on much more fat than muscle. So at the end, they may end up being back at the same weight number on the scale, but they will have much less muscle compared to when they started. And this can be a significant problem, as we've already discussed. So let's run through a couple studies that look at this problem. So in a study of about 78 postmenopausal women, and they followed them for about 12 months, and they found that for every 1 kilogram of fat lost during the weight loss intervention, about 26% was from lean tissue, okay? But for every 1 kilogram of fat regained over the following year, they only put back about 0.12 kilograms of lean tissue. So they lost about 25% and only put back on about 10% when you look at relative to fat either lost or put back on. So you could see that they ended up putting back on much less muscle and put on more fat. In another study of about 2,000 men and women aged between 70 and 79, they found the same problem, but more significant. So men, when they lost weight, about 60% of that weight loss was from lean tissue. So again, mostly muscle. And in women, that loss of lean tissue made up 40%. So this is significant loss of important tissue, again, important muscle. But on the reverse side, when they were putting back their weight, so men only put back 21% of the weight that they put back was from lean tissue, and in women, only 24%. So you can see that the net overall, when they went through this cycle of losing weight and putting it back on, they end up almost back in the same place in terms of overall weight. However, unfortunately, they end up with much less muscle. And again, as we discussed before, that has significant impact on their overall health. So how do we solve this problem? Again, during weight loss, unfortunately, some of that weight loss is happening from muscle breaking down. So this muscle proteins are breaking down. So we need to do the opposite. We need to make protein synthesis. We need to get the muscles to build back up. And this we can do through exercise by trying to build up our muscle strength and therefore our muscles. And here there are studies that show that by implementing strength training, exercise while someone is dieting can dramatically reduce how much of their weight loss is coming from muscle. And some studies suggest anywhere between 50 to 90% reduction in that weight loss coming from that important muscle, and therefore protecting that muscle during weight loss. Let's look at our first study that analyzed the importance of adding exercise, particularly resistance training, to someone who is dieting. So in this meta-analysis, they had 6 randomized controlled trials. Here they were comparing those people who were just on a diet, calorie restriction, versus those who were doing a diet and added the exercise. In this case, this was resistance training 3 times a week for 12 to 24 weeks. And what they found was that in those people who added resistance training to their diet, they reduced the loss of lean body tissue by 93% compared to those people who were doing calorie restriction or just diet alone. This is an astonishing result. This shows how important, how effective including resistance training can be, so that when someone is dieting, to help protect them from losing too much muscle. Corroborating these findings, again, another analysis, but this one that had 52 different articles within it. And they found that, again, that adding exercise to the diet significantly reduced how much of the weight loss was coming from lean tissue. So it went from those who were only doing diet, where they lost 24% of their weight was coming from lean tissue. In those who added resistance training, only 11% of their weight loss was coming from lean tissue, again, muscle. So here, almost a 50% reduction in terms of how much of someone's weight loss was coming from lean tissue or muscle. Now that we see that exercise is important when someone is losing weight to protect their muscle, the question is, what kind of exercise? Can it be aerobic, or does it have to be resistance training? And so both can actually help, although resistance training seems to work best. So let's go over a couple of studies here. In this study, they had 20 people, average age about 38 years old, and they split them up. Half of the group did diet plus aerobic exercise, and the other half did diet plus resistance training. The resistance training, that was done 3 days a week. They had different stations that the patients would work their way through to do their exercise for strength training. And for the aerobic group, they were doing 1 hour 4 times a week, either walking or biking. And what they found was that in the group that had aerobic exercise with diet, lost a significant amount of lean body tissue. And in the group that had added resistance training, had almost no observed lean body tissue loss in that group. Let's wrap up this video and go over a few key points. So number one, 25 to 50% of weight loss can come from lean tissue, which is mostly muscle, and that is a significant problem when patients are going on a diet. Number two, after people lose weight, there's a significant percentage of patients who put back on that weight, but unfortunately when they regain their weight, they're putting on much more fat than muscle, and so net, they end up back where they started, but with much less muscle. Number three, losing muscle is a significant problem because studies have shown that less muscle as people get older can significantly reduce overall health and longevity. And number four, combining both diet, calorie restriction, together with resistance training, that combination can help people reduce their weight, but most importantly, reduce mostly their fat and help keep their muscle. And this is important for, again, their overall health. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.